Hi everyone, my name's Emily Huffman. I'm a fourth-year student at the University of Pittsburgh School of Pharmacy, and today I'll be discussing our quality improvement project. We evaluated the impact of increasing heparin concentration in central lines in NICU patients at UPMC Children's Hospital of Pittsburgh. Central lines are a critical component of neonatal care. They're used for medication administration, total parenteral nutrition, and hemodynamic monitoring. However, their use is associated with complications, which include infection, bleeding, and thrombosis. In neonates and pediatric patients, central line placement is the leading risk factor for thrombosis, which can result in severe complications such as pulmonary embolism, stroke, and catheter occlusion. Additionally, central line associated thromboses increase the risk of central line associated bloodstream infections, and this is because clots serve as a growth medium for bacteria. While prophylactic anticoagulation has been shown to improve line patency and reduce CLABSI risk, evidence in neonatal populations remains limited. Current recommendations are largely based on adult data, despite the distinct pharmacokinetics and pharmacodynamics in neonates. In this study, we sought to assess the impact of increasing heparin concentration in central lines from 0.5 units per ml to 1 unit per ml on central line associated thrombus incidence and CLABSI rates, to evaluate associated bleeding events, and also investigate potential cost savings of our intervention. This was a single-center, retrospective evaluation approved by the UPMC Quality Improvement Committee. Data was collected from the electronic health record, and we utilized descriptive statistics. Our study population included NICU patients at UPMC Children's Hospital of Pittsburgh with a central line placed at a UPMC facility who were receiving central line fluids with heparin. For our study objectives, we sought to determine the incidence rate of central line-associated thrombosis in NICU patients who received heparin concentrations of 0.5 units per ml in comparison to those who received heparin concentrations of 1 unit per ml. We sought to evaluate the incidence of central line-associated thromboses with CLABSI, and then also to identify any adverse bleeding events with the increase of heparin concentration. Looking further into our study design, we compared outcomes from two separate cohorts. Our pre-intervention group, so patients who received heparin 0.5 units per ml from October 2020 through April 2022, and our post-intervention group, patients who received heparin 1 unit per ml from July of 2022 through January of 2024, and that followed a 2-month washout period. Next, to summarize the graphs we have in the bottom center, the first is a comparative incidence of central line-associated thrombotic events. Here, we can see a decrease in the incidence of central line-associated thrombosis after increasing the heparin concentration. The pre-intervention group had a thrombosis incidence rate of 1.57 per 1,000 central line days, whereas the post-intervention group had a reduced rate of 0.62 per 1,000 central line days. Our second graph shows the comparative incidence of CLABSI. Here, we can see there was a reduction in CLABSI incidence following the heparin concentration change. The pre-intervention group had a CLABSI incidence rate of 0.15 per thrombotic event, while the post-intervention group had 0. And lastly, the infographic in the top right shows the comparative incidence of adverse bleeding events across our study. As you can see, there were no adverse bleeding events in the pre-intervention group. However, there was one occurrence in the post-intervention group. In conclusion, the incidence of central line-associated thrombosis decreased following the intervention, suggesting that increasing the heparin concentration may be associated with improved line patency and reduced thrombotic events. CLABSI rates were also lower in the post-intervention group, though it is worth mentioning other infection prevention strategies were implemented during this period. Even though there was one bleeding event in the post-intervention group, there was not a statistically significant increase in the incidence of bleeding between the two groups. Our next steps are to conduct a prospective review of all bleeding events associated with central lines, and also to assess potential cost savings from the increase in heparin concentration. Thank you so much for your time. Please see below for our references, and I hope to see you at the conference.